Welcome students to a brand new video of Scholars. Today we will learn about what is fracture. So our topic for today is fracture. First, where the bone resistance is overcome by stress, which causes break in skin. Now we will learn about the causes of fracture. It can either causes of fracture which can be due to either traumatic incidences or due to vigorous play, due to non-accidental trauma, or neonatal fractures. Its symptoms are pain, swelling, tenderness, and snap and pop sound. Now we will learn about what are the pathological types of fracture. The pathological types of fracture are multiple, but we will discuss only 5 to 6. Number 1 is transverse fracture, oblique fracture, spiral fracture, green stick fracture, impacted fracture, and segmental fracture. There are many more types such as avulsion, stress, pathological, compression, epiphyseal, impacted, communicated, open, closed, but we will learn about only 6. Transverse is a horizontal line. Oblique is at an angle. Spiral is along a spiral shaft. And green stick is that is broken at one end and bent at the other. Impacted is that is impacted into another bone. And segmented is that is broken into small pieces. Now we will learn about what are the types of fractures in children. That is plastic deformation, buckle, green stick, and complete. Now we will learn about the clinical manifestation or the stages of bone healing. Bone healing. There are 4 stages, that is hemostasis, which includes the rupturation of blood vessels, and inflammation, which includes the different cytokines, the mast cells, the anti-cytotoxins, etc. And the next step is called soft callus, which starts at 1 to 2 weeks, which includes cartilage take place. Hard callus is 3 to 6 weeks, which includes the bony chondrocytes. And the last one is called bone remolding, in which the bone takes its shape. Thanks for watching our video. Please like, share and subscribe to our channel to get more informative videos. Thank you.